So a well-heeled middle-aged gentleman walks into my clinic at HUP, and I work there as a cognitive neurologist, and he comes in and says he's got some memory problems, probably the single most common complaint that a person might come to see me for. And I talked to him a little bit, and as best I can tell, he doesn't have the kind of memory problems that people with Alzheimer's have. What he really has is that this is a guy who's really stressed out. He's going through a divorce. He's got a very high-powered job. And his attention isn't what it's used to, but because he's got probably an affective disorder that's situational. So I say, look, and he's worried about Alzheimer's disease. And I tell him, look, I don't think you have Alzheimer's disease, but what I really think you have is a kind of minor depression, not the kind that makes you curl up and huddle in the corner of a room, but this is affecting your memory. Let me treat you with an antidepressant. He's willing to do this. I give him a selective serotonin reuptake inhibitor. In a few weeks, he's starting to feel better, and things are going well. Then he calls me up and tells me that his daughter, who is one of these amazing freshmen at Penn, is not doing as well as he thinks she's capable of doing, and asked me if I would see her, if I could get a sense of what's going on. I talked to her and examined her, and it looks like maybe she has a mild form of attention deficit disorder. She is natively very bright, so that she managed to get through high school without much of a problem. But given the standards at Penn, she's coming up against some limits. So I suggest perhaps she should take Adderall. She's willing to do this. She takes it. She starts to do well by her midterms, and everybody's happy. My patient now is starting to think a little more creatively. And he tells me that his son, who is now a junior in high school, is a pretty smart kid. And he's also a pretty decent athlete. He's a runner. And he thinks that he will probably get into a pretty good school. But if he were just a little better as a runner, he might get into an even better school. And he asked me if there's anything I can do for his kid, who's a long-distance runner. And I say, well, not sure there's anything that's clearly approved or clearly beneficial, but there is an interesting study that was published in the Annals of Internal Medicine a little while before, which was a study done with mountain climbers at Base Camp Alpha by Mount Everest. And what this study showed was that when these very fit young men were given a drug called sildenafil, more widely known as Viagra, that this actually changed the blood flow patterns, not only in one of Woody Allen's favorite organs, but in their lungs. And along with this, that their oxygen carrying capacity improved. And so the question was, would this help a long-distance runner improve their oxygen carrying capacity? So I tell the guy, I don't really know if this would help, but maybe it's worth a shot. We bring it up with the son. He's quite excited about the possibility. Takes the drug, does well on the field, as well as off, and looks like he's going to get into a top-notch school. Okay, so now my patient, who is not risk-aversive, as most successful people are not, tells me that he is vying for a contract in Saudi Arabia and is planning to fly there. And it's quite competitive, and he's trying to figure out how he can get an edge. And he decides that if he learns Arabic, that maybe this will be an edge in negotiating. He won't have to use a translator, and he thinks that culturally this might be viewed in a way that would give him an advantage. And he says, I'm going to take a crash course in Arabic, but is there anything you can do to help me learn this better? And I say, well, I don't really know, but there is some data that amphetamines tends to help learning. There's very good data in animals, and there is some data in patients when they've had strokes and they have an aphasic disorder, language disorder. If amphetamines, relatively small doses, 10 milligrams of dextroamphetamine, paired with speech therapy, that people tend to recover a little bit better. So the question is, would he's going to take his course, if he pairs this with small doses of amphetamine, will he learn better? He's willing to try it. We try it. He learns Arabic. We don't know if he learned it better than he would have otherwise, but he feels confident that he's learned it quite well, and he's going to fly. I give him a prescription for Ambien for the plane, modafinil when he gets off. He flies through the thing, gets the contract, comes home, is delighted, and he wants me to open a brain spa. So, okay. So the point about all of this is, for you to sort of tap your own intuitions, which is, as I was telling this story, did this seem to you to be a reasonable thing, a great thing, or were there points at which you started to feel uncomfortable? And let me tell you, just to sort of cover the kinds of things that we can do in terms of enhancing people. There are three broad categories. So you can certainly improve people's movement. You've all heard about steroids. There are various other ways in which we can help people's strength, speed, stamina, motor learning. You can think about attention, memory, and learning. We've heard a little bit about that, and there are these kinds of medications on the right that are either available now or are anticipated to be available in the near future. And then we've talked about mood and affect. As you can see, as Sharon talked about, there are even ways where you can try to bleach painful memories of the painful part of them, oxytocin, inducing trust, and so on. So in all of this, there are four reasons why you might start to feel uncomfortable with all of this. And the first is safety. With all of these, there's always a question of safety. For Adderall and Ritalin, as you may know, the FDA has a black box warning, which is considered the most serious of warnings. There is the possibility of addiction of people who do not have ADD when they take this. And there's also a very, very small but real risk of sudden death. You can get arrhythmias from this. And this, of course, the risk of this gets greater as you get older. There are other kinds of risks which are not side effects in the way we normally think about them, but there may be cognitive trade-offs with this. So for example, if people are taking these stimulants that get them really on task all the time, might this actually have consequences of other things like creativity, for example? And those are things that are not normally thought of or looked at when people engage in these kinds of medications. The second is this issue of character. We all have this notion, I think it's well embedded in the culture, of no pain, no gain, that you really have to struggle. There's the notions of achievement. We talked a little bit, Sharon talked a little bit about this, about dampening painful memories. But the question is, if you are constantly dampening painful memories, what ends up happening to us as individuals and us as a group? There are certain kinds of painful memories we don't want to forget. For example, culturally, we say things like civil rights museums, Holocaust museums. These are important, and they're important because we don't want to forget them. And the question is, what happens at an individual level is if you have the control to dampen these painful moments in your life, what ultimately happens. And there are some notions that even senses of empathy are predicated on your having had certain painful experiences. Without that, it's very hard to have empathy. So this becomes a real issue. There are issues of distributive justice. We spent a good part of this morning hearing about the kind of financial aid that Penn is providing for middle and low-income applicants, and that those are attempts to try to deal with issues of distributive justice. The same would be certainly apply for these kinds of medications.